20 new cases today. 5 are linked to Trinity Grammar. That's 1 staff member, 2 students and an additional 2 household members. So that's 5. 5 more are linked to Miss Frankie's, 2 staff, 1 patron who visited on the 15th and 2 household contacts. That's 10. 3 are linked to Young and Jackson's. All are workplace contacts of a positive case who was present at the pub. That's a small workplace. We're comfortable that we've got our arms around those cases. So that brings it to 13. 3 are linked to St Patrick's in Murrumbeena, 2 students and 1 household contact. That's 16. 2 are linked to Amy Park. Both are patrons seated within 2 or 3 rows of the index case there. So that's 18. 2 are linked to Bacchus Marsh Grammar, both household contacts. That's 20. 1 is a worker from the Westgate Tunnel who is a close workplace contact of a case there. That's 21. And 1 is a family member of the previously unlinked case that we announced yesterday from the northern suburbs. So that's 22. So I can advise our epidemiologists have formally linked that case from yesterday to the Coolaroo cluster. They're related to one of the earlier cases in that cluster. And we're continuing to support the households there. In terms of primary close contacts of some key sites, so MCG has 3,900 primary close contacts. 70% of those tests have been returned. Amy has 2,300 primary close contacts and 66% of tests have been returned. Trinity Grammar, 2,600 primary close contacts with 76% of tests returned. Crafty Squire, 433 primary close contacts with 70% of tests returned. Ms Frankie, 822 primary close contacts with 83% of tests returned. And Phillip Island, 803 primary close contacts with 57% of tests returned. So thanks so much for everyone who is getting tested as primary close contacts. We know it can be a real task, especially in awful weather. There might be sites where you've had a bit of a wait. All I can say to you is please keep at it. As those tests return, we just get more and more assurance that we've got control of this. In terms of priorities, we do still have some concerns, obviously, about Amy Park and the MCG with the levels of transmission that have occurred there. So with the additional 2 cases today at Amy Park, outdoor transmission, not seated, absolutely adjacent to the index case, but a couple of rows away. That's not unheard of in indoor areas, but to occur outdoors is of some concern. So just a reminder, if you are sitting in Zone 2, Sections 22, 23 or 24, you need to be quarantining right now. So that's quarantining for the 14-day period. Doesn't matter if you've had a negative test initially, you're quarantining for that full 14 days. The same goes if you entered through Gate 7 between 7:56 and 8:13 p.m. And if you're in any other area of Zone 2, get tested. There's a map on the exposure sites listing, so have a look if you're unclear about that. In terms of our red zones, yesterday, as many would be aware, South Australia became an orange zone, retrospective to 12 of July. So anyone who's been in South Australia who returned up to late last night into Victoria needs to get tested within 72 hours and return a negative test before they come out of isolation. Tonight at 11:59 p.m, it'll become a red zone. If you're in Victoria now and have been in South Australia at any time since 12 July, as I say, get tested, stay isolated until you get that negative result. We hope that South Australia emerges from this relatively quickly and that after their 7-day lockdown that we can make changes in line with any changes that they might make. Finally, with over 300 exposure sites online, many more in private homes and other smaller settings, our intelligence team, our epidemiologists do go through a continuous review process for those sites. to validate all of the times, the dates and locations. There will be minor modifications over time. Some sites have been removed as the individual was determined not to be infectious at that time. Others have been downgraded, others can be upgraded. So please continue to check those exposure sites and understand that they might have some modifications over time. Finally, look, 22 is a large number. It might have looked concerning for those who were following on Twitter this morning or who saw the number come up. But the 16 of 22 fully isolated for their entire infectious period is a really good sign. That has changed dramatically in the last couple of days. I expect it to be improving over time. It may even be that within a couple of days we don't see anyone who's been out in the community for any of their infectious period. It is due to people quarantining strictly through that quarantine period. It is a tough thing to do quarantine, and it's tough because it's very strict. You cannot go out for food, you cannot go out for services, even essential services. You cannot go out for work. You must stay at home strictly for that 14-day period, and even as that early test that you need to do comes back negative, you'll need to stay in for that 14-day period. You'll be cleared at the end of it with a negative test with your 14 days expiring, but it is that quarantine that so many thousands of Victorians have done and are doing that is making us get ahead of this outbreak, and we're absolutely going in the right direction. So there is much, much to be hopeful for.